For every product on the market, you can sue the manufacturer for harm, for design defect claims, meaning the claim that the product could have made safer. I mean, literally, look around this room, planes, cars, pharmaceutical drugs, every one. There's only one product in America. You cannot sue the manufacturer for design defect claim to claim that it could have been made safer, and that are vaccines. I heard, injections, vaccines. My definition of vaccine is any product for which the government needs to give it immunity from harms. To me, that's what a vaccine is, because some prevent infection, some don't. That's what a vaccine is, meaning it can't survive without that immunity, apparently. Why did vaccines get this immunity, which was provided in 1986 under the National Childhood Vaccine Injury Act? Because leading up to 86, there were only 3 routine childhood vaccines, MMR, OPV, and DTP, and they were causing so much harm and causing so much liability that all the manufacturers were going out of business to stop making them. And Congress, instead of forcing those manufacturers to do what every other product manufacturer needs to do in that situation, which is what? Make a better, safer product. Instead said, you know what? We're just going to give you immunity. We're going to make it so nobody can sue you for those harms. And you can keep selling your product to the American public no matter how many children it kills or injures. And the issue is that immunity was not just given for those 3 products. It was given for any childhood vaccine, routine child vaccine that was developed thereafter. I tell you this not to take issue with childhood vaccines, but to explain to you the regulatory framework in which vaccines have developed over the last 40 years. We have now gone from 3 injections in the first year of life under the CDC schedule in '86 to 29 injections, including in utero, if a child follows the CDC schedule today. Every one of those vaccines, save one, was developed by a pharmaceutical company knowing they would not be responsible for the injuries that are caused by those products. So when you have drug trials where pharmaceutical companies, they care about losing money, they don't want to lose money on their drugs, they often do multi-year placebo-controlled trials before they get on the market because they don't want to end up upside down. They're there to make money. But with vaccine products, because they don't have that financial incentive, they have the disincentive. Almost every childhood vaccine in this country is licensed based on clinical trials with no placebo control, save for COVID-19 vaccine, often days or weeks, up to maybe 6 months of safety review after injection, and are often extremely underpowered. Those trials could never have really confirmed the safety of this product, and my submission to this committee laid out every single vaccine and put them in detail.